Let's dive in a little bit more about fertility and what does that really mean. And I think we have a graphic that hopefully we can go to in a little bit. But tell us just general concepts of what fertility means. And both, by the way, not just female patients as well, right? When we speak about infertility, Alina, we're talking about both men and women, right? I always say, I'm a primary care physician, as our audience knows. And infertility is something that affects both sides of the table, like I say, right? So our graphic here shows.
So absolutely. So infertility, as you mentioned, is across diseases and across sexes.
Absolutely.
Here we're going to be talking about when are women considered infertile. For example, if they have premature menopause, which means that instead of your average age of 50 or 55 or let's say 60 for you to stop having menstrual periods and having ovarian function normal, based on sometimes our treatments move that up a little bit, and sometimes creating the problem of an early age,
correct,
stopping from producing eggs and eventually being infertile. Then obviously the eggs that the ovaries carry can be damaged by our treatments.
Okay.
So sometimes for that matter the ovaries cannot make further eggs, or for example let's say that surgery that alter the anatomy, the normal pathway of those eggs into the uterus gets altered, then no matter that an ovary can make an egg, it cannot be reaching the uterus where it eventually has to be attached to in order to produce a human being, right? So then the egg cannot be fertilized. So for example, here's where the man infertility will come into play. Let's say the partner of a female is the one that is undergoing these treatments and is affecting their testicles or the possibility of forming sperm. The eggs won't be able to be fertilized. And then lastly, after an egg can be fertilized, and for several reasons cannot be attaching to the uterus and cannot lead to a viable pregnancy.